Hi, everyone. This is Julia, and this is my clinical presentation. So this semester, I worked at Essentia on the Med-Surg unit, floor 14. Most of the clients that we had required intensive care, but the populations were very diverse. There was a lot of different disease processes that we got to see. A lot of the clients were either post-op, just getting done with some operation, or pre-op, getting prepped and ready for that operation. And a lot of our clients also had internal medicine issues, so it's something like diabetes, heart failure, hypertension, or pulmonary issues. So the client that I chose, his name is John Doe. He's a 39-year-old male. He's full code and has no known drug allergies. He was flown into Essentia 7 days ago due to inflammation and infection of his colon, and he has a history of frequent ER visits due to alcoholism. He has now been diagnosed with alcohol abuse and diverticulitis. John states that he wants to go home. However, he confesses that he will never change his habits, and he also says that he claims to be the worst alcoholic he knows, and says that he doesn't think that he could handle life without it. The main goal of John's treatment is to prevent further infection and help him gain his strength back so that he can be discharged. So, for a background, he has a history of frequent ER visits due to alcoholism, stomach pains, and he also is a frequent smoker. The priority concern for this client is either sepsis or infection. Um, this would be due to inflammation due to his own blood and infectious agents that reside in his own blood. This can result in some pretty severe complications such as fever, shortness of breath, low blood pressure, tachycardia, and decreased consciousness. Sepsis can result in organ failure and also has a high occurrence of death. This affects John Doe because he has had on and off infections in his bloodstream for about a month now. He has not gotten these infections under control, and they therefore are resulting in sepsis. Due to the way that he reacted to the simpler infections, it has become a concern that the sepsis could not only destroy his organs, but possibly result in death. The interventions that have been given so far in the hospital are monitoring his labs, eyes and O's, and vital signs, administering medications, and putting the client at an NPO status. Per assessment, John has an increased blood pressure and heart rate. He has difficulty passing stool and has had no gas within the past 24 hours. He's severely underweight. His BMI is 14.6. He's restless due to alcohol and tobacco cravings, and again, he is not having anything by mouth. Um, he his labs show an increased white blood cell count, positive E. coli, and positive culture for multiple other bacterium, and a decreased creatinine and sodium. With diagnostics, he has been diagnosed with diverticulitis per endoscopy, and per blood work, he has decreased hemoglobin and hematocrit, which show signs of possible blood loss. All assessments align with the diagnosis of diverticulitis. So, with these diagnoses, we are administering three primary medications, one being ciprofloxacin, and this is used to treat bacterial infections in many different parts of the body by killing bacteria or preventing its growth. Some side effects could be dark urine, abdominal pain, bloating, nausea, and vomiting. Hopefully this medication will lower his white blood cell count, E. coli, and bacterium levels, and hopefully decrease his bloating and increase his comfort. Then we have docusate sodium. This is used to treat constipation associated with dry, hard stools. It helps to soften your stool by increasing the amount of water in it, and it has possible side effects of nausea, diarrhea, and stomach cramps. The client will hopefully be able to pass gas and stool after taking docusate sodium. Then lastly, we have normal saline, which is used for extracellular fluid replacement and is indicated by a mild sodium depletion as well. It does this by replenishing lost water and salt in your body, and it has possible side effects of venous thrombosis or phlebitis extending from the site of the injection, extravasation, and hypervolemia. And the client's sodium levels will hopefully increase to therapeutic range after taking normal saline. The recommendation is the recommendations have my nursing diagnoses and my nursing interventions. So for diagnoses, I have, most importantly, risk for infection. This is my highest priority due to its history of sepsis, its urgency, and its difficulty to treat. Secondly, I have risk for GI bleeding. This is due to his GI upsets and diverticulitis. GI bleeds can be hard to treat and result in some pretty serious repercussions. That's why it's my second diagnosis. And then lastly, I have risk for seizure, and this is due to his alcoholism and now withdrawal, which could become a severe issue if gone untreated and unnoticed. So to intervene, we are going to keep monitoring his labs, eyes, nose, and vital signs. This will ensure that the nurse understands the status of the client and his infection. Then we're also going to administer medications as prescribed. This will help fight the infection, inflammation, and hopefully prevent that GI bleeding. And then we are also going to bring in a social worker with the nurse and talk with the client about the impacts of his alcoholism and tobacco use on his overall health and wellness to see if we can help him understand the impacts of um, alcoholism and tobacco use on his overall health and see if maybe we could convince him a little bit to try and pull away from that, even though he's pretty convinced and set in his ways that there's no way he could stop. Reflecting on my clinical experience, I feel like it has just completely changed my view of nursing. It has really shown me how much I know, like how much all of us know, just watching my classmates, watching me like understand what's going on with our clients is really cool. It's helped me realize that nursing is powerful and that it's something that I do want to do because I've been questioning that for a while. And it's been a really powerful experience to be able to feel like I'm making a difference. And it's also helped me understand humanity a little bit better. So it's helped me see that a lot of these people, they need a human connection along with medical treatment, and that both of those things are really important. And then my Benedictine value that I chose is love of learning because I feel like that's what our clinical experience has really been all about, is just having, like, a really open mind and jumping in to do anything that is available to us, and also asking as many questions as possible. And I feel like my clinical instructor did a really good job of, um, enhancing my learning and just helping us kind of find love for that. Um, and my 2 biggest takeaways is just really how much, we all have learned in these past 2 semesters and how different I feel like all of us are viewing um, nursing and different disease processes from just 9 months ago to now is really cool. And then also just how impactful a nurse can be on a person's experience in the hospital and how important it is for us to just really meet every person where they're at and really see them for how much they can grow rather than what their um, disease has done to them so far. It's really cool to see people get better and um, that we each can believe that that can happen for everyone. So I feel like I've learned a lot this semester, and these are my references. Thank you.